Oh, hi, Chris here from Equine Dental Clinic. Just wanted to share a very quick case with you. Now, it's extraordinarily rare that I do a dental extraction in a stable, and I normally say that we don't ever do that, but today this horse couldn't be transported and it desperately needed an extraction, so we've come to the yard to perform it, and you can see our patient is nice and sleepy here. Extraction is done. I just wanted to quickly talk you through the tooth, because it's a really nice case to demonstrate how horses can have these problems developing without anyone really knowing about it, and also a really good spot by the referring vet to actually identify this in the first place. So the vet, Natalie from South Coast Equine, just came along to do a routine dental rasp. The horse is in really good body condition, no abnormal clinical signs. What she noted was that one side of the arcade, the teeth were darkly stained on the 2 and 3 arcades, and on the 1 and 4, everything was normal. So she examined the 1 arcade with a mirror and found a sort of a discharging bloody tract in the attached gingiva between the 208 and 29, and then on probing found that there was some pus coming out. So took x-rays, sent the x-rays through to me, and diagnosed very quickly that there was a really marked apical abscess affecting the 209 tooth. And I'm going to show you that tooth now. So I came out and I just repeated x-rays just to be doubly sure, and then just proceeded immediately with an extraction. Sorry, I thought I was showing you the horse then. So this is where we did the nerve block. She's had a catheter in, which has now come out, and all done. And we started at 3:48 and we finished at 2:14. And that was really everything: catheter, nerve block, gingival retraction, molar separation, and extraction. So I'm just going to show you the tooth now, because it's really quite interesting. So I'm just going to switch to a different view. Okay, so here is the tooth, and I'm going to zoom in on it a little bit. So this is the outside of the tooth, this is the inside of the tooth, and this is the surface, and that's how it would have presented in the mouth. This is the outside down here on the bottom, this is the inside at the top, the palatal view, so that's buccal at the bottom, and the front or mesial is to the right and distal is to the left. So if we look at this sort of distal buccal root here, you can see it's blunt and short, and it has this big thick layer of sort of reactive soft tissue attached to the apex. And you can see this root is blunt, it doesn't look very happy at all, it's got a nasty grey discoloration or grey hue to it. And then right over the other side of the tooth, so this is now on the mesial aspect between the 8 and the 9, we can see this discharging tract. So there's a little hole in the top of the tooth there, and it started discharging pus from the dead tooth, and then it made its way through this canal down in between the teeth. So this would have been exactly on the outside between the 2 teeth, and it's been discharging pus for, well, we don't know how long, some time, until Natalie managed to spot it. So there we go. So really interesting case. No clinical signs, but a really dead tooth, a really bad apical abscess, and a really nasty discharging tract. And actually in this case, all dealt with in the stable, but as I say, we don't normally like to do that. I'm going to show you my adaptation for a drip stand. Here it is. We have a fence post tied to the corner of our surgical table with vet wrap. So that's not something we normally do, but we do these cases sometimes in other countries and Africa and so forth, where there aren't other facilities. So it is possible, as long as you get nerve block and everything set up and do everything properly, but not really my recommendation. Anyway, so there we go. Interesting case, very dead tooth. Hope you found that interesting. See you all later.